That's us started.
Thank you, Neil. Good afternoon, everyone. Welcome to the meeting of the East Lothian Integration Joint Board on 28th of March 2024. The meeting's been recorded and will be made available as a webcast in order to allow the public access to the democratic process in East Lothian. East Lothian Council and NHS Lothian are the data controllers under the Data Protection Act 2018. Data collected as part of the recording will be retained in accordance with the Council and Health Board policies on record retention. The webcast of this meeting will be publicly available for up to 6 months. Move on to taking apologies and a roll call of attendees.
Thank you. We have apologies from Jeremy Finlay, from Patricia Cantley, both of whom have nominated substitutes. And we have apologies from Philip Conaglan and John Hardman. Are there any other apologies from members that I need to note? No, that's great. I'll go through the roll call of attendees. Shameen Akhtar.
Present.
Lynn Jordan. Thank you. Carol McFarlane.
Present.
George Maguire.
Present.
Thank you. You're here in place of Jeremy Finlay. Andrew Cogan.
Present.
Elizabeth Gordon.
Present.
Fiona Ireland.
Present.
George Gordon.
Present.
Thank you. Here in place of Patricia Cantley. And Maureen Allen.
Present.
Thank you. David Binney.
Present.
Lindsay Byrne.
Present.
Sarah Gosner.
Present.
David Hood.
Present.
David King.
Present.
Claire MacDonald. Claire McIntosh.
Present.
Thank you. Marilyn McNeil.
Present.
Thomas Miller.
Present.
And Fiona Wilson.
Present.
Thank you. Can I ask if any members have any declarations of interest on any of the items today? No? Great. Before we begin, can I just make a quick statement? If there are any members of the public in attendance at the meeting today, just to confirm that members of the public may only observe the proceedings. No questions or statements may be permitted from anyone other than IJB members and officers of the Partnership, Council or Health Board. We're now ready to move on to the business, Chair.
Thank you. Move on to agenda item number 1, which is a minute of the last integration joint meeting on the 22nd of February. Can I ask if there's any matters of accuracy on page 1, page 2, page 3, page 4, or page 5? Okay. We're agreed it's an accurate reflection of that meeting.
Yes.
Okay, thank you. Move on to agenda item number 2, which are matters arising from the minutes. Any matters arising on page 1? Page 2? Page 3? I just wanted to pick up the around the appointment of a carers rep to the IJB. I know David Binney was appointed, so I just want to thank the communications team for the work that's being carried out to raise awareness of that role much wider across the county, so carers are aware of David Binney's role and are able to approach him and engage, and I think that'd be really helpful. Also just highlighting the importance of that role on the IJB as well.
You're on mute, Chair.
Any matters arising on page 4? The financial update, I know we've got papers following, which will cover that, and anything on page 5. Okay. I'll move on to agenda item number 3, which is the Chair's report. The few things that I just wanted to raise for today, since the last meeting, probably the biggest change is that there's been the legislation now being introduced, and we'll see the introduction of a national care service for Scotland, and it's past stage 1 at the Parliament. It does have general principles of the bill which have been passed, which are improving standards, strengthening the role of the workforce, better support for unpaid carers. Alongside this is the employment of 180 staff by government to service the National Care Service with a spend of 40 million. I attended a meeting of colleagues through the Convention of Scottish Local Authorities around the future of the bill, and there was real concern that as we're seeing both governments underfunding health and social care, that there were questions around what exactly will the National Care Service be overseeing once it has been introduced and implemented. So there was a real concern around that some of these issues that have been highlighted would be adequately addressed with through fair funding. The other area I wanted to highlight was I attended a briefing on dental services across the Lothians, and it was for IJB members across the Lothians. And one of the areas that I raised is how we make sure that there's appropriate dental services where there is highest levels of deprivation. So I'm happy to share that presentation with you because there is an additional support for dentists operating in areas with higher levels of deprivation, but there was an acknowledgement that there were issues in dentistry across Lothians. Also, there was a meeting of the Association of Day Centres. Again, we had the opportunity to hear about the work of the day centres across East Lothian, the significant levels of preventative work that they've been doing, and the outreach work that they've been carrying out to support carers. And also, it was good to see that they'd been engaging in the procurement process, and their contracts for the day centres had been renewed for the next 2 years. I don't know if anybody has any questions or anything that I've covered. I'm more than happy to send links to the latest updates on the National Care Service, if that would be helpful for people. Okay, thank you. Move on to agenda item number 4. And that's a review of the 2023-24 financial outturn. And is that yourself, David King?
Yes, thank you very much, Chair. As you say, this is a review of the 23-24 financial outturn. And I think there are 2 points here that this paper is trying to raise. It's important to note before we start that we will not actually know what the outturn is until May. And so this is based on the forecasts that we have currently available to us. So we start off 3.1. We just have a little review of the current information we have about the forecast outturn. And as you can see, at this point in time, we're forecasting an overspend somewhere in the region of £3.8 million. Just under 3 million of that is social care, and the remaining element comes from the health part of the IJB's budgets. So 3.3 really moves very quickly through some kind of ideas as to what generates these financial pressures. 3.4, I talk about the set-aside budget model here. Now, forgive me, this may seem like a little bit of distraction, but this will become apparent, I think, in the later papers as to why this is in here. And if members can just cast their minds back to what the set-aside budget model is, what it does is it represents those functions that are managed in the acute part of the NHS Lothian system. That's in the Royal Infirmary of Edinburgh, the Western General Hospital, and St John's at Howden. Those functions that are delegated to the IJB, and our share as East Lothian IJB of the budgets and the actual costs of these functions. When that model was put together back in 2015, it was done on a fairly high level basis, and we were always in the process of reviewing it. That a great deal of work has taken place over the last few years, and we have finally reviewed that model. And what we have discovered is there were budgets and costs in that set aside part of our system that were not with the benefit of hindsight, really delegated functions, and therefore we've now reduced these. We've now taken those budgets and the costs out. So what I'm trying to say, not very well, is that having revised the set-aside budget model, we now have a model that, first of all, the set-aside budget is going to be slightly less, but much, much more importantly, it now represents functions that are actually delegated to the IJB and therefore services over which we have an influence. Now, in terms of financial impact, there is no financial impact because services like services are no longer delegated, we're no longer getting charged for them. So that is not financial pressure in our system. I'm saying this because the current model in 23-24, we're carrying on using the model we've got. In 24-25, we'll use the revised model, and we will come to that. We'll talk about it again. So the first point about talking about 23-24 is the financial pressure in the system. NHS Lothian have a model which takes account of the underlying pressures in the system and puts it into next year's position and starts to recover on it. In social care, we haven't currently done that. And we've discussed this previously, but what we now see is a forecast overspend in social care, as I say, of £3 million. That is not going to go away in the 31st of March. We require to have a recovery plan to deliver that. We have built that into our 24-25 budget setting process. So the point of this paper is to say there is an overspend forecast. We've built that into the 24-25 budget setting process. The second issue is that of reserves. The IJB has got a range of reserves. It's earmarked reserves, which is money earmarked for specific projects, and what are called general reserves. And now the general reserves, as we sit here, are somewhere in the region of £5 million. We have already agreed we will use 750,000 of that in order to underpin the costs of moving from analogue to digital, which leaves us around about £4.3 million. If you look at paragraph 3.5, section 2, I have quoted the integration scheme. And the integration scheme then tackles the issue of overspends at the year end. What it says is, if there's an overspend and there are insufficient available reserves to meet the overspend, then the parties, in this particular case, East Lothian Council and NHS Lothian, may make additional payment to the board. Now, we therefore need to consider what our position is on that matter. So we have got an overspend forecast of, as I said, £3.8 million and roughly £4.3 million of a general reserve. So if I may move, well, Chair, first of all, if I may take any questions, and then obviously we'll want to move on to the recommendations.
Do you have any questions for David? Fiona Ireland and then Lynn Jordan.
I think actually
And then
George is
George.
ahead of me.
George Gordon, and then Fiona Ireland and then Lynn Jordan.
Okay, thank you. If we're using reserves to actually stock up this year's budget, I mean, what does that leave the reserve position? Is there not a minimum requirement by Audit Scotland to actually hold the reserves to cover the trading costs for a reasonable period? I mean, I know in West Lothian it's £2.5 million they have to maintain in reserves. Will this not cut the reserves very close to that margin?
No, is the answer to your question. There isn't a minimum requirement. We've gone back and looked at the legislation and the recommendations. The reserves are part of the management of financial risk. And in an ideal world, clearly, we would have a reserve, as you suggest. Our target's about 2%, which is about £3.5 million. We would have a reserve, and we would hold that reserve to deal with crises and various sort of financial bumps, if you like. The IJB is although it's governed by the same kind of regulations the councils are governed by, it is in actual fact governed by the integration scheme. And the integration scheme is very vague in the matter of reserves. But basically what it says is that if the partners do not have any more resources or are not prepared to give the IJB any more resources, then it has to use its available reserves. And I know that other IJBs in Scotland have already thrown all of their reserves into this position. So clearly it's not a good position to be in. Our financial model for 24-25 is based on the presumptions that we will not have any reserves, but there is no obligation to have reserves at a particular level.
Can I just come back for a second question, Chair, if you don't mind?
Yes.
That's concerning me because, you know, post-COVID, the reserves were a highly important element that was really important. The second question, has there been any discussion with the partners at the present moment about the potential of actually looking to meet the costs rather than cutting into the reserves?
Yeah, we've spoken to the partners and had quite a long conversation. They find themselves in an extraordinarily challenging financial position as well. And they have really said, well, you know, what's the IJB's point of view in this? This is going to have to be a negotiation, and I think we're asking the IJB what its view is here.
Okay, George, that helped answer all your questions. Okay, thank you. Fiona Ireland.
So, David, I wonder if, first of all, we can just look at the fact that we've got this overspend. So first of all, I think you said there was no financial impact in the changes in the set-aside. Is it not, in fact, the case that there's an improvement in our position of circa 1 million? Because previously we were addressing a 2.9 million overspend from the set-aside services. Now we're reporting a 1.9 million overspend. So that's an improved position.
Yeah, sorry, I've probably conflated two things. I wanted to talk about the change in the set-aside model because it impacts upon 24-25. And with the benefit of hindsight, I guess I should have put that into the 24-25 budget setting paper, so apologies for that. The 23-24 position, they haven't used the new set-aside model, so the position has improved, but that's simply a result of additional work being done by our colleagues in the acute system.
But it does, in fact, give us a benefit.
The change in the model will give us a benefit, but we won't receive that benefit in a year.
£1 million. Yeah. And the second part I wanted to ask about was the legacy, I suppose, of the budget and how the council overspend or the social care overspend element is made up. Because my understanding is that actually we've got a bit of a compound effect over years because of the reductions that were made previously. Now, can you just clarify exactly how that overspend's made up? And how much of that is compounded by underfunding, which we've addressed in previous committees, I accept.
You make an interesting point. There's probably three elements to that. There's a significant element of demand in the system, of new demand in the system, and we all discussed many times the whole issue of demography. There is an element of funding issues from previous years, and I kind of feel that we need to move past that. We have, after all, been using that budget for the last year, so we have accepted it, and I understand the discussions that took place last year, although I wasn't here. And the third part, and a colleague mentioned COVID earlier on, is COVID. Although the funding for COVID has gone away, and you will remember we had a significant COVID reserve, and that was clawed back by the Scottish Government. The COVID has forced the way the services are delivered to change, to take account of the pressures from that whole issue. And that unquestionably generates pressures in our system. So I haven't broken it down into detail. I've got a sort of financial breakdown. It shows which budgets are overspent and which budgets are underspent. But we haven't sort of gone back and unwound it there because I kind of feel we have to move on from the position we're in. I hear what you're saying, Fiona, and we could go back and do that analysis if you think it would help.
So I think it would help. And the reason I think it would help is I think everybody would accept that we've had no uplift for the demography and the increase in services as a consequence of that. However, I think that the fact that we're talking about an overspend which has arisen because of a compound effect of a not offering through the full amount year on year is an unacceptable position to be bailing out using reserves.
Okay, we'll look into that.
Okay, that answer your question, Fiona Ireland? Okay, thank you. Lynn Jardine.
Thank you. I first of all want to sort of highlight this is my second year as being an IJB member and also my second year of being a councillor. And in this discussion, I am increasingly aware of the extent to which that as a councillor, while I'm politically appointed, I am not a political appointee on this board. I'm very much here acting in the interests of the IJB and not, as understandably some might have seen from last year's discussion, from a more partisan position. What I wanted to ask is we don't actually have a definite recommendation in this report. I note that David goes a long way to stressing the importance of the integration scheme. I just want us to consider the extent to which the integration scheme really sets out this as a partnership. And I'm slightly concerned that we've not had an opportunity to have a discussion about potential challenges around a difference of opinion that might exist across the two key partners, and that might leave us in a slightly difficult position again this year.
Do you want to come in on that, David or Fiona?
I mean, I think it's a very, very good point. I mean, everybody's heard me say that IJBs live or die on two things. One is their relationship with the partners, and the other one is the partners' relationships with each other. And I certainly want to do everything I can to support those relationships and support that. And any discussions that the partners wish to have, then that would help. I think that would help a great deal.
Okay, thank you. Did that help to answer your
Yeah,
question?
I suppose maybe a slight follow-up. If you had to make a recommendation between those two options that are on this paper, could you make a recommendation?
That's a good point, because technically speaking, I can't make a recommendation because either of those recommendations simply says go back to the partners and have a further conversation. And I accept perhaps recommendation A doesn't say that, but recommendation A will relate to what the partners then do to resolve the financial position, because there's still an awful lot of things to be done between now and the end of May to drive out sort of actual financial figures. So my recommendation is to support the partnership as much as is possible, I think.
Thanks
Okay.
for that, David.
Does that help, Lynn? Okay, thank you. Andrew Cogan?
Thanks. As an even newer member to the IJB of the year, I still am getting my head around all of this. So and I think Lynn's question before really helped me. David, it's just a matter of kind of factual accuracy here. If we supported option A, essentially that would end our reserves going forward. Just to check I'm correct in that assumption.
Oh, yes, yes. Well, actually, to be fair, if these numbers are absolutely correct, we'd have about £600,000 less when you think about 4.3 less 3.8. Yes.
Thank you.
Okay. Do we have any other questions for David on this paper? Maureen Allen?
Sorry, that was a mistake, Shimeen.
Okay, no problem. Do we have any other? I don't see any other hands up for David for any questions. Okay. And what we've been asked is the paper that's been presented to us is asked to look at recommendation 2, 2.1, which is noting the 23-24 outturn, noting the projected position for the IJB reserves, and then being asked to vote on recommendation A or B around the utilisation of the general reserve to support the 23-24 year-end position, or request additional funding from the partners to meet the in-year gap for 23-24. I think it's really clear that we know as we go through the papers it's a challenged position for both partners, and realistically will either partner be able to support us in helping us to fill that gap? I doubt that. I think it's been publicly well documented of the levels of funding and the lack of funding that's been awarded to both partners. Okay. We'll move on to, as this paper requires a roll call, we'll move on to that.
Thank you, Chair. As you've outlined, the recommendations are in section 2.1. So I'll ask members to please indicate if you're content to note recommendations 2.1, 1 and 2, and which option you wish to approve for recommendation 2.13, option A or option B. Councillor Akhtar.
Option A.
Mr. Cogan.
I support 1 and 2, but I would have to go for option B.
B. Thank you. Councillor Maguire.
Option A.
Thank you. Ms. Gordon.
Option B.
Thank you. Ms. Ireland.
Support 1 and 2 and option B.
Thank you. Councillor Jordan.
Happy to note and option A.
Councillor McFarlane.
Happy to note an option A.
Thank you. And Mr. Gordon.
Happy note in option B.
Okay. That's recommendations 2.1, 1 and 2 noted. On recommendation 2.13, we have an equality of votes between option A and option B. That means under our standing orders that the chair has to direct the chief officer or the chief finance officer to further consider this issue and bring it back to the IJB.
Okay, thank you. Move on to agenda item number 5, which is the budget offer from the IJP partners 24-25.
Thank you, Chair. So again, I was just thinking back in the history of this whole kind of thing and what we're trying to do here. So the IJB has got functions delegated to it. It prepares a strategic plan laying out the delivery of these functions. It issues directions to the partners, telling the partners how it wants the functions delivered. And in order to do that, it requires a budget. Now, we spent a lot of time at the beginning of the IJB in 2015 just discussing the budget. Is this an adequate amount of money? And all the details around that. And since then, what we have done with the budget offers is to look at them incrementally. So we've come along every year, we've got the budget offers from the partners, and we've asked ourselves a couple of questions about these offers. Now, the first test we've asked ourselves is, does this meet the Scottish Government own budget? When the Scottish Government issues its own budget, it also says to the councils and to the health boards what the offers from them to the IJBs ought to be. And very briefly, there are sort of two parts to that. The first part is that the offer should not be less than the previous year. Now, that is why I talked about set aside, because technically speaking, and actually, in fact, in the total figure hasn't changed very much, but that's a function of the way that the system works and money flows into NHS Lothian from the government during the financial year. And then, of course, the IJB share comes into the IJB. But the set aside position has changed, and it's changed, but that has no impact on the IJB. So functions that were delegated to the IJB are no longer delegated to the IJB, and the costs of running those functions are no longer charged against the IJB. So in that sense, I think that particular test is going to be met by NHS Lothian. The council, now let's look at the council first of all, because we've got its offer there, and I've sort of summarised that in 3.7. The baseline, the opening baseline budget has not reduced. So that's the first part of that test. The second part of the test is that money should be passed on, that is earmarked for IJBs. And if you look down that particular list there, the baseline social care budget, there's elements of it not delegated. There have always been elements of it not delegated. So we're simply stepping through the arithmetic. That minus 540 is exactly the same as it's been in previous years. And if you see underneath that, you'll see that there's money, funding for the real living wage, there's funding for free personal nursing care, and there's funding for self-directed support. That is money that the Scottish Government has given to the councils and asked the councils to pass on to the IJB in full. The council have done that. Then there's this whole issue about pay awards and uplifts. The council do not get pay awards or any other kind of inflationary uplifts as a general rule. What happened in 22-23 and what happened in 23-24 is that the government have given the councils additional resources. And I say additional, I mean, let us say for the sake of conversation, that the base pay award is considered to be 3%. If the base pay award was past 3%, then the government have given the council additional resources to meet that difference. Excuse me. And you can see from this particular thing under 3.7, in 23-24, the council have got some additionality as a contribution towards the pay award. They have taken the IJB element, sorry, they've taken the social care element, which is the IJB budget, and they have passed that money on. So they've taken the opening baseline, added on some additional money they got to contribute towards pay awards in 23-24, and increased the baseline. And then they have put all the other Scottish Government pass-throughs, real living wage, etc., through the budget as well. So on the sort of absolute terms, the council have completely met that first criteria. Have they passed on the things that have to be passed on? What is not obvious in the face of this document, and I explain it underneath, is the impact of the change in the pension contributions. So when you employ somebody, you also contribute towards their pension. That pension contribution has now reduced. So that means effectively, to all intents and purposes, it is cheaper to employ somebody than it was before. That is a financial benefit. That financial benefit is somewhere in the region of £714,000 for the social care staff who are employed by social care, but the funding, of course, is controlled by the IJB. Now, that benefit has not been taken off the council's budget. So the IJB has got the benefit of that £714,000, and that has been built into the 24-25 planning process. So I think you can hear what I'm saying here is I think we should accept the council's offer. If we come back and look at NHS Lothian's offer, NHS Lothian got a flat budget settlement, and all those colleagues who are members of the NHS Lothian board will have heard this discussed and have seen the presentation which I circulated around the IJB. What they have done, what NHS Lothian have said, is that when the Scottish Government when pay awards are agreed in the health service in 24-25, the Scottish Government will make the funding available to the NHS Lothian. NHS Lothian will then make the funding available to the IJB. So they will pass on the pay awards as they come through the system. So the first criteria, have they not reduced the budget? No, they have not. Have they given us money that should come through the system for pass-throughs? Yes, they have. Has been achieved. The second criteria, which is really about fair. Well, sorry, I should finish that off. The other part of the first criteria is, will they pass on any money that they should pass on? And the NHS Lothian said, yes, we will. And the council have already given us benefits from various other things. So that first criteria has been met. The second criteria, which is a question of fairness, have they given us all the money they've got? I think you can hear from my conversation and the descriptions in the paper that that has also been met. So my recommendation is that we, the IJB, accept both of these budget offers from our partners, noting that the NHS Lothian offer is indicative. It's indicative because it will not agree its budget for 24-25 until its meeting in April. And it's indicative because we do not know what the GMS allocation is yet, because the Scottish Government hasn't announced it. Chair, any questions?
Thank you, Mr. King. Do we have any questions for Mr. King? Nope, I don't see any hands up or indication of questions. I did want to come back on one of the areas that we do have significant levels of pressure across East Lothian is around our GP practices. And I wonder if you're able to say, because further on it does make reference to that if the GMS contract is less, of there being significant pressure in the system. And I just wanted to find out, in the GMS contract, does it acknowledge population growth? Because I think in other areas where you've got different challenges, ours is quite significant. I wonder if is that likely to change, and will it acknowledge population growth when we do get the actual figures later on?
I think the GMS budget is based on a kind of model with list sizes, and the list sizes, as they grow, should address some of these population issues. I'm not an expert in GMS. I do apologise. We will have the GMS budget relatively soon in the financial year, and we can bring a proper paper back to the IJB, just laying out any challenges and trying to address this issue of demography, which is clearly a very, very significant pressure across the whole of our system.
Okay, thank you. I think the same applies to the levels of support for primary care, but that might come up later on in the next paper. Just want to check if there's any other questions. Andrew Cogan?
It's just a statement to welcome the two budget offers. I think in the enormously challenging financial environment that we face next year, I think we should welcome the offers from both the council and from NHS Lothian.
Okay, thank you. Do we have any other comments or questions? I don't see any. I agree with the comments that you make, Andrew Cogan, and as we see from the attached papers from both parties, the level of financial risk and the level of financial sustainability is really challenging. And I think I take cognizance of the fact that both are on the risk register for both parties, which shows you the level of lack of resource that we have in the system with an increasing level of demand. Okay. I don't see any more questions or comments, so we'll move on to the roll call.
Thank you, Chair. The recommendations are set out in section 2.2 and 2.3. 2.2 to note the proposed budget offers and 2.3 to accept the 24-25 budget offers from both partners. Councillor Akhtar.
I note and accept.
Mr. Cogan.
I too note and accept.
Thank you. Councillor Maguire.
Yes, noted and accept.
Thank you. Ms. Gordon.
Noted and accept, thanks.
Thanks. Ms. Ireland.
Noted and accept.
Councillor Jordan.
Noted and accept.
Councillor McFarlane.
Noted and accept.
And Mr. Gordon.
Noted and accept.
Thank you. That's the recommendations approved unanimously.
Okay, thank you. We'll move on to agenda item number 6, which is our budget setting for 24-25. What I will do is we will allow officers to present the papers, and then what we will do is take questions, and I want people to take their time and ask as many questions as they want. And after questions, we will take any comments that people have. I know this is probably one of the most difficult IJB meetings that we'll have had since the time that I've been on East Lothian Integration Joint Board, and I want to take the opportunity to say to you, ask as many questions as possible, and I will allow the officers to present those papers and we'll work our way through them.
Chair, before we go to the report, can I just say that I've had a couple of messages to say that some members of the public who had joined the meeting were having sound issues. And it's just to confirm for the recording that this recording of the meeting will be available online directly after the meeting, so they will be able to hear and see everything then.
Okay. Can I ask if that's been communicated to the person who's not able to hear the meeting?
I will communicate it now.
Thank you. Thank you very much. Okay, well, I'll pass that on to Fiona Wilson and David King.
If I may start, Chair, and I'll sort of hand over to Fiona, and then, as you say, we can work through this paper with more detail. We've obviously set a budget, and having done that, the next part of the exercise then is to examine what pressures there are in that budget, and everyone's aware of the financial position in which we live. Now, it's worthwhile just thinking for a second about what is the role of the Section 95 officer. What's my job? My job is really very, very simple. I cannot sanction expenditure if there's no income to cover it. You can't spend money you do not have. When we sat down and looked at this back in December, we sort of cast forward, tried to look at what 24-25 would look like. And these numbers are December's numbers, but basically we came to the very rapid conclusion that if we did nothing, if we carried on doing what we are currently doing in the way that we are doing it, at the end of 24-25, we would be overspent by more than £11 million. Now, we cannot set a budget. We cannot have an unbalanced budget. We must set a balanced budget. We can't move forward on the basis that we're planning to spend £11 million that we do not have. And I apologise for saying that, since it's extremely obvious. So the next point then was for me to say to colleagues, to the IJB, what are we going to do about this? We need to come up with propositions, proposals, saving schemes, whatever we wish to call them, that will close this gap. We need to move to setting a balanced budget for 24-25. Now, I need to start off by thanking everybody, because the management teams have spent an enormous amount of effort, have thrown up a whole range of ideas and all sorts of proposals and projects and schemes, and we have looked through those and we've evaluated those and we've tried to work out some kind of financial resolution. I'd also like to thank the members of the IJB. We had 2 workshops and people sat down and listened to the conversation. The conversation was, do you understand? Do you understand? Sounds very patronising. Do we understand how we got there? And I like to hope that members who were at those workshops did understand how we got there. And here are the propositions on the table to resolve that. And let's have that conversation, let's have that dialogue, and let's just work our way through these things. And I'm very grateful for people engaging. I mean, I appreciate there's an element of this being a financial exercise to a financial position, but at the same time, colleagues have worked with me and I'm very, very grateful for that help. What we said we would do is we would continue to review the position, and that's what we've done. So if you look at this paper, it starts off talking about the December position, and then it moves on to discuss all the various bits and pieces of review that we have undertaken since then. And the current figure, which is on section 3.3, says there is a gap in our 24-25 budget forecast of 10.8 million pounds. I apologise, 10.8 million pounds. Now, I've put an appendix at the back, appendix number 4, that just lays out in a high level as to how we moved from where we started off to how we moved and where we'll end up. But it's really quite important to say, what are we going to do about that? Now, again, there's a little bit of conversation about some of these pressures, but it's interesting to go back and think about that first workshop we had. And you'll remember that people talked about process, and there's a kind of triangle, and the triangle starts off at the bottom, what they call grip and control. Now, this sounds pretty bad because one is not suggesting for an instant that any of the management teams do not have grip and control. But what we can say is that it's possible to improve that grip and control. It's possible to drive out further financial savings from the system. And that part of that whole discussion, of course, is to involve all the staff in this process. This is not something that comes from the manager. This is something that the whole team recognise they have to do and work through that. The next level of thing we had on that particular thing were things we called efficiencies. And we worked through these. That's all about delivering the service in a different way. Efficient is not a fair word. It's simply a more cost-effective way. And the important thing about grip and control and efficiency, the important thing for us as an IJB to consider is, does that impact upon the strategic plan? Does that impact upon the strategic objectives? And a great deal of effort has been done trying to resolve these issues. The last part of that triangle, if you like, the very top of the triangle, was what were described as choices. Now, the original intention was that we would have a long list of choices and we could work through it and say, well, you know, what are the least worst choices on this particular list? It has not been possible to do that. It simply isn't possible to find enough choices. What we're left with is a list of proposals. And those proposals are required to balance this budget. Now, as part of all of this work, fresh ideas came out. And we've categorised these fresh ideas as service redesign. And the reason for categorising them as service redesign is we don't want things to sort of sneak in to this whole table of what are we going to do to break the budget even, without people being able to see what they are absolutely clearly and unambiguously. So what we have then is a series of appendices that work through all of these things. There's an appendix that looks at what all the grip and control is. The appendix number 2 lists out the major service redesigns and the proposals, and all the detail of those things in appendix 2 is captured in appendix 5. Appendix 5 is the various things and the impact of them and the various pieces of work that's gone around trying to describe them, trying to explain how they'd be delivered, trying to explain what impact they might have in the strategic plan, etc. So having done all that work, what you're left with is what's on table 3.9. Table 3.9 then says how much money, if you like, is on the table to try and close this gap of £10.8 million. And again, that's categorised into grip and control, efficiency, service redesign, and the proposals at the end. And what you then move on to is to try and work through the arithmetic. So 3.13 summarises the arithmetic. And what it says, as you can see, is we start off with a pressure of £10.8 million. There's grip and control and efficiency schemes in the health and social care partnership £4.8 million. That's the 4768, you can see it up the page. There's service redesign of £2.1 million. And then I've said adjustment for set aside. Now, we talked about set aside earlier on. Fiona's absolutely right. The impact of changing the set aside model reduces the pressure in 24-25 by about £1 million from our original model that we put together in December. Now, that's very, very good. The obvious point there is that those pressures haven't gone away. Gastroenterology, for example, has been taken out. Infectious diseases have been taken out. These services remain considerably overspent, and that pressure is going to have to be managed elsewhere in NHS Lothian. And clearly, come back to our previous discussions about partnerships, we have to be aware of all the relationship issues and all the things that our partners are managing. What we're seeing here is that the sort of base set aside position is net of 1.4 million. I say net because set aside also has, as you can see in table 3.9, some efficiency schemes. And there are efficiency schemes in the hosted services as well. So we've taken those two sets of efficiency schemes, offset the gross pressure in set aside, and that leaves a figure of 1.4 million, 1391. Now, I think everybody recognises that no one IJB can resolve the set aside issue. So my proposition is, or our proposition is, that all the IJBs will work together with NHS Lothian and drive out a series of solutions to address this pressure of £1.4 million during the financial year 24-25. So for the purposes of our budget setting exercise, we are taking that out of that equation. So 10.8 million, less grip and control and efficiency, less the pressures and set aside, leaves a balance of £2.5 million. This is arithmetical, I absolutely accept that. If you look back at the proposals, you will see the proposals are greater than £2.5 million. Now, the key point about the proposals, which I hope we will discuss in detail, obviously, is that these are difficult things to action. These will take time to deliver. There's a whole lot of range of risks, financial, operational, and governance around these proposals, and they will not all be delivered in 24-25. Therefore, the proposition here is that we will require £2.5 million of them to be delivered in 24-25. If you move on to Appendix 3, this tries to lay out the balanced budget and show against the various lines. NHS Core, Social Care. Core, remember, is the Health and Social Care Partners budget for East Lothian. Social Care, hosted, those are the functions that are hosted by other parts of NHS Lothian but relate to East Lothian population and set aside of which we've spoken. And you can see the arithmetic on the page, and you can see that the gap at the bottom of the page is 3091. Remember the set aside position, which we are going to tackle collegiately with our other partners. And that is, if you like, the balanced budget that we are proposing. Now, a couple of very quick points before I hand over to Fiona, and I think you will all be able to recognise this. First of all, how do we monitor this in a year? At the moment, we get a Q1 report in September. You do not want to be sitting down in September with your first look at the financial position for 24-25. And I've spent a lot of time talking to our partners about how we can resolve this, how we can get even very, very high level intelligence back to the IJB much more quickly. I think that's very, very worrying. And the second thing we mustn't forget is this is part of a 5-year financial plan model. We started off trying to develop a 5-year financial plan. We immediately discovered significant pressure in 24-25. We're moving to resolve those pressures. Once we've done that, then we need to build that into the 5-year financial plan model, and then we need to say what 25-26 looks like in 26-27. And that is work that I would like to carry out very early in the summer, so we can not be sitting here at this time next year having a similar conversation about the 25-26 budget. So if I could just pass over to Fiona at this point in time.
Thank you, David. So just to add to what David's saying, I mean, the team have worked hard to get these proposals, and they're looking towards doing the right thing for people that has the least impact all of these proposals have been worked up. They've used data, they've engaged with people over the last few months and in some cases years. It is important for me to mention people because they're at the heart of everything that we do. Our strategic plan looks at care close to home and the development of how we've developed intermediate care system services. And I'm really thoughtful, and as the chair said earlier, these are really emotive, difficult decisions. And I'm thinking about the people involved today, the residents, the families, and our staff. They're challenging, but it needs to be balanced with us not standing still and designing services that meet the needs of our local communities across the county, that are sustainable. And we will work closely with people, whatever the decision, to support them. And finally, and David touched on this, the risk at 3.7. There is risk associated. We're not shying away from that, but we've tested out the deliverability to make sure that the proposals are operational. If approved, we need to deliver them as rapidly as possible, and this would be done in a planned way. The consequences of not approving them is that the decision not going through is that we'll not have a balanced budget, and we'll have to make decisions in a reactive way to mitigate this. And that will involve holding spend in areas where that may lead to worse outcomes for people and greater risk. So I'm keen to hand back to you, Chair, and open to ask any questions. I think it's important for people to ask any question they've got, because we want to be as transparent as possible around how we've come with these proposals and really provide assurance as to how we've got there.
Okay, thank you. I'll open up to questions now. Thomas Miller, and then Maureen Allen.
I wonder if you can tell us, Fiona, what impact taking over 60 beds out of East Lothian, what impact that will have on the front door of the Royal Infirmary?
Yeah, thank you. So as part of the engagement sessions that we've had through our provisioning work, we have done the assessment around kind of beds and looking at the services. So just to pick up, some of the work that we've done is around looking at the admissions, looking at our use of acute beds, and we've been sitting around 85% of the acute bed base. We also note, just from the changes before my time, that with the reduction in beds that there hadn't been any impact. And the other thing just to add around beds, so we talked about the front door, also about the back door, and around how we monitor people and the pathways that we're using. So we're seeing more people going directly home and less people going to a care home. And I think somebody in the team will come in, but we're at the lowest use of care home beds since 2018. So we're using that data, Thomas, to help inform our decisions, but not just using data, but also engaging. What do people want? Where do people want to be? And really trying to kind of triangulate these conversations.
Okay, Thomas, did you have any other questions?
Yeah, I do actually. Bellhaven, Arstow, in old terms, Ward 1, it's Blossom House, are council residents, but these beds are leased to the council from NHS, and it's historical for 20 odd years. How much an income does NHS receive from those beds, which would be a loss? And how much is each resident actually paying, or the council paying on behalf of the residents, compared to the private sector?
Okay, I'll probably ask for a bit of support on this one from the team. I don't know if Laura or Gillian. I suppose there's a kind of mix. There's a mix of residents, so they could be local authority or they could be self-funding around that rate, and there's the contribution difference in that case. And my understanding, the council pay a contribution, but I don't know that exact figure off the top of my head to NHS Lothian around that. I don't know, David or Laura, anybody can come in and answer that question. My understanding is the income is much less than the cost and it's subsidised, but I would just want clarification on that. Laura, do you want to?
I see Isabel and Laura want to come in.
So that's right. On terms of the finances, we have a mix of self-funding and national care home contract rates, if you like. So the self-funding rates, along with our other local authority homes, have always been less than our independent sector. However, we're now in a position where we're able to balance that up, and they will be of a similar rate in line with the CRAG guidance. It is correct as well to say that ELC have been paying NHS Lothian for the lease, if you like, or for the provision of those services. I don't have the figure to hand, but that has been the arrangement for not 20 years, but a number of years now.
Okay, thank you. Isabel, did you want to come in?
So you'll see from one of the papers that's in there in Blossom House at the moment. We've got, it's 11 bedded and 9 of these, and I think we've got about 9 people in at the moment, and you'll see that in the paper that's been submitted. 3 of the people are self-funding and 6 are local authority funding. Now, people that are self-funding are entitled to free personal care, free personal nursing care or free personal care, and that's at about £300 a week. And then the local authority, I've got figures about what the contribution is to that, not necessarily Blossom. I'm thinking it'll be the same with Blossom House, but I can certainly give you some of the figures.
Grand. Sorry, Chair, I've only got 2 other questions.
Yeah, that's fine.
My second last question is, how much money has just been spent in the last 6 months in renovating Belhaven? And my final question, I'll give you that at the same time. Where did I put it? The value of the properties, if they were to be sold, the profits made from selling the properties, where does the profits go? Do they come back to the IJB or do they get swallowed up with the NHS?
Yes. So your first question around the total costs, I can't answer that, Thomas, I don't have that information to hand, but we can get that to you from Moray Campbell from Estates. The second question, my understanding is that it becomes a capital, an asset, because the IJB doesn't own properties, so it would go back to NHS Lothian.
Thanks.
Hey, Thomas, did you have any other questions?
Maybe just one more, and that's around Ward 2. Ward 2 houses the community staff as well as the vaccinations, but also the hub for hospital to home, which was relatively new prior to COVID. Where would the hub be for the community staff? Because if it was to go back to Haddington again, how many new staff would need to be employed just to stand still on the number of visits, because you'd have to build in the factory travel for the staff?
Yeah, no, that's a really good point, and it's something that we've recognised through the provisioning, and Jamie might come in on this, but I suppose we recognise that kind of local needs around staff, but I think what we've heard through the provisioning, and we've heard through even just some of our SPG, people aren't wedded to buildings. So there's a recognised need that locally we don't want people doing excess travel, particularly from an out of hours, local access, but there's not been through our IAs this need that has to be on the Belhaven site. But what we don't want is to build in additional costs, because that's not the answer. I don't know if Jamie was coming in. Sorry, Chair. I saw his hand pop up.
Jamie, did you want to come in?
Yes, thank you. Just to explain that with the Belhaven, if that closes, then the vaccination service would need to reconfigure that and move to a 3-site model for our main clinic. So we'd be using ELCH, Edington and MPCC. We have worked from that model previously to deliver COVID and flu vaccinations. And what we would be doing is then looking at how we mitigate the impact from that through, for example, using the RVS voluntary transport service that we have at the moment that already supports the vaccination programme.
Okay, thank you. Thomas, does that help to answer your questions?
It answers part of the community staff one, because vaccination is only part of the community staff, but I'll give other people a chance to come in.
Okay, thank you. Maureen Allen, and then George, and then Lynn.
Thomas, thanks, Sinead. My first question is probably a bit of a flashy question. Are the officers going to go through all these proposals individually? So is Gillian in that? Because obviously Thomas has asked questions about Blossom, and I have just questions on paper 6.
I'll just comment. No, the plan wasn't to go through them individually. That's why we'd use the time in SPG, as Strategic Planning Group, and the additional meetings to go through them with IJB members.
Okay, perfect. So now I have a lot of questions, not just one.
Fine.
So sorry about that. My first is a statement. I mean, concern around the statement that on page 26, there is no alternative saving proposals available for consideration other than those outlined within this report. It is therefore the strong recommendation of officers that the 24-25 savings programme is agreed in its entirety by the IJB. My concern is that there is no room for manoeuvre with the savings, and obviously my main concern will be the communities and voluntary sector. My first question, and I'm sure I'll pick up other ones, is what specific measures are proposed to mitigate around identified risks associated with the budget setting process? Because obviously there is a lot of mitigations in there, but it seems to be hitting the community sector, voluntary sector, harder than others by the looks of it. That's my first one.
Okay.
If it makes sense.
Yeah, your question is around the impact, the savings that have been asked to be made with the voluntary sector, that you feel the impact is disproportionately higher. So I wonder if somebody can come in on that one. Laura?
I feel as my paper represents the Commission Services and Community Services. I'm not sure I would agree with that, Maureen, and just on how...
That was really my question. Sorry, Laura, that was really my question for David, just for paper 6. And now I'm having to scrabble and see what my other questions were. So I've maybe thrown a kind of side curve there. So I do apologise if you can't answer it.
Well, I could only answer it to say is I'm not, well, unless David, you're wanting to come in, but I'm not sure. So I agree the communities and the third sector have had to, we're proposing some budget cuts there. I don't think it's disproportionate to the other cuts that we are seeing. And as you know, we're working closely with those providers and those services to ensure their sustainability and review the cuts and the impacts of those cuts on those services. But I'm concerned maybe that's not what you're asking me.
No, and that's what I'm saying. I've kind of got thrown off my story there because I did think we were only talking about the first paper. I'll come back on though. Sorry about that, people.
It's okay.
I think maybe David wanted to come in and try and answer something. David, did you want to come in?
I think, excuse me, I think that Maureen's point is a good one. And I was trying to address that when I was talking to the paper. I'm not involved in the operational process, as you can imagine, since I'm the CFO of the IJB. And what I've done is to simply challenge people to bring back ideas, and then listened to the conversations at the workshops and other places in here about what are these ideas, how realistic are they, how do they impact upon people, and I think my point was, and the point of that paragraph really was that at this point in time, I'm not seeing any other solutions on the table. And we have said, and I'm not trying to throw the problem back out here, but we have said that if other colleagues have got other ideas, then that would be very useful. We were always keen to investigate other permutations and combinations, but at this time, we really just don't have anything else.
Okay. And Maureen, did you want to come back?
Yes, I can. I've now got my thoughts together. So thanks for that, David. And I think one of the key words that you've used there is time. I think, again, we need time to actually have better conversations and moving forward with the next 5-year plan. But I mean, I suppose for me, the kind of cumulative overview that I haven't is, reduction in key services. The funding cuts to services like the community link workers, the advocacy services, and community-based mental health organisations. These are all going to directly impact on the availability and quality support for vulnerable groups. So again, there's huge implications there. Local organisations heavily rely on these services to meet the needs of their communities. Reductions in funding may lead to a decreased or will lead to decreased capacity, increased demand for alternative support and potential service closures. Again, there's huge challenges here for this third sector community linked work service. I mean, a 54% reduction as a budget cut is absolutely horrendous, and I think it's really unpalatable to cut a service by 54%. But again, I'm happy to put these further forward. But yeah. So no real question there, I suppose. More a statement of my concerns.
Okay, Fiona, did you want to come in on that one? You had your hand up.
Yeah, I just wanted to come back just to really recognise Maureen's concerns, and I recognise for our board and for us, you know, these are not palatable. They are hard places to go. But I think I'm confident as we have the work that we've done, and we started and we brought papers through the IJB around the provisioning work, around some of the data that we've got, how we've engaged with you. I am confident that these are decisions. These are in some cases the least worst decisions. If we were to look at alternatives, and we've asked yourselves as an IJB, what else can we do? And not anything. Oh, have you thought of this? I think we're all in a place where it is very, very difficult, and there's not a second plan. And the second, if there was, we're going to have to mitigate. I think, Maureen, your question was around mitigation. It is about that spend. Well, how do we manage day to day not spend? Is that less care packages for people? Is that holding people in hospital? Is that greater risk in the community? And this is why we've put these proposals forward, to try and balance in a planned way of the data that we know, of the choices people are making, of what the local communities are saying, how we can give proposals that will kind of create the least impact. But that's not, I think it's back to your point though, Maureen. They do create impact, and it's acknowledging that. We're not shying away from that.
I mean, I think the statement, you know, what else can we do, and you're putting it back out in the communities. Actually, the communities haven't really been consulted a lot on this. We've had the IIAs, but again, that was another rush process. My hope is, and I mean, I totally acknowledge that we are all hard pushed here. We all got our day jobs to do on top of everything else, and the ask is huge. The ask on the community is huge. But I think for me, going forward, again, I ask that we have these conversations sooner. We work alongside yourselves quicker to try and mitigate against losses in our communities.
Okay, thank you, Maureen. Okay, was there anything else? Maureen, was there any other questions?
You know, because I've got hundreds, Shameen, but I don't think it's fair to just hold the limelight today.
Okay, I'll move on to my list. I've got George Gordon, and then Lynn and Marilyn, and then David. My apologies if the numbers mixed up. That's the numbers that I see on the screen. George?
Yeah, I mean, I've got a number of questions, but really a comment first. I sit in West Lothian IJB and Edinburgh IJB, and I'm only deputising here, so I'm sure the question I'm about to ask has probably been well thought through with the work days with other members here. One of the questions that was actually touched upon, which I think I got a satisfactory response for, is, you know, the closure or the potential redesign with the care homes, you know, who are ultimately responsible for the maintenance and upkeep of these buildings, and who are going to get the capital receipts on that. That was one of my questions. That's kind of been touched upon. The other one is there's a use that I see within here of East Lothian Community Hospital, which is a very clinical environment. It's not a care home in reality. I mean, what has been thought about, you know, having individuals there as a temporary measure? Is there any measure being put in place to look for more permanent facilities in a less clinical environment? Because nobody wants to be effectively stuck in hospital all the time. So it's a kind of counterintuitive to me, sitting on NHS Lothian, to be putting people back into that hospital environment rather than a care or care at home environment. So just to ask that generalised question, but I realise that we have to get to a balanced budget, and I'm sure a lot of this has been worked through already.
Okay, thank you. I see Fiona Wilson and Gillian Neal's hand up, and is that to answer George's question?
Yeah. So thank you, George, and a helpful question. So with regard to Belhaven, I think you're referring to, and the assessment that required people to move into East Lothian Community Hospital as a safety measure, as a place of safety that we did. We would agree that is not a long-term option for people, but I suppose that's a different question being asked at that stage, because that was on the background of a fire inspection report, and for all purposes our goal is to get people back there, and that's the estates team. That's a separate question running alongside. So we have not had discussions around long-term alternative placement, because actually what we want to do is try and get them back to their own homes. This is separate, which I get muddies the water a little bit, is around the proposals which sit separately to that process. I'm going to bring Gillian in and just talk about maybe just some of the discussion you've had with the care inspector, Gillian, as well.
Yeah, thanks. So I was just going to clarify the points that Fiona made, just because they were moved around the fire risk. However, we have been working alongside the care inspectorate, because George, you're absolutely right. This is people's homes. So we're working with the staff and the relatives to make the inpatient environment as homely as possible, because that is a requirement through the care inspectorate. So we're doing that as we speak, and have moved a lot of furniture and very much personalising that space, so that it doesn't feel sort of clinical, as you point out, in the interim.
Okay, George, does that help to answer your questions? Do you have any more?
No, obviously, the actual ownership of some of the actual care homes are mentioned in IIA was an interesting point, but I think that's been already exhausted, so I'll leave it at that. But thank you for that input.
Okay, thank you. And Lynn Jardine.
Thank you, Shameen. I've got a few questions, and I'll say up front, I've probably got a lot more questions, because unlike some of the board members, I wasn't actually able to participate in some of the intermediate meetings, because just the speed at which we were working at, and my lack of availability in terms of my commitment to other committees that I sit on, etc. I think what I want to address first of all is on that issue of the speed with which we were working. Fully appreciate the conversation we've already had, and Maureen's highlighted it around, going forward, we want to do things better. But I suppose I'm very conscious that as a councillor, we've been sitting talking about the impact of budgets for months and months and months and months. We've known for quite some time, before the Scottish Government even gave its budget, that the situation was going to be dire. So I'm slightly concerned that we left it until, well, it appears to be from this paper, that things were kind of left until the government's statement in December, when we know that both Scottish Government's situation and the Westminster Government feeding that down was going to be the most challenging we've ever had. So, what have we learnt from that, and are we got a commitment to making sure that that does not happen going forward? And within that, the paper talks about a lot of assumptions. I'm just wanting to get a sense of how confident are we that the recommendations that are in this report have, because of the speed with which we've been working, that those assumptions and risk assessments are as comfortable as we can be with them. That's my first one.
Okay, thank you, Lynn.
Yeah. Sure.
David King.
Yeah, no, I take your point about timing, and yes, it hasn't been as well as we would wanted to have done it. We should have started working on the 5-year plan before we started working on the 5-year plan, and I think we were surprised at the magnitude of the overspending year, to be honest with you, and I think the Health Board was slightly caught out by the Scottish Government budget settlements. But those are excuses, and I absolutely accept that. And as I said in my discussion, I absolutely agree with what everybody said about time. And when we will continue to work in the 5-year plan, and we will spend, I would like to think, a large chunk of the summer doing that. I just repeat what I said before. I don't want anybody here to be doing this, having this same conversation in March 2025. So I absolutely take your points, and I wouldn't disagree with that. The assumptions, well, perhaps that's a wee bit of an exaggeration. A lot of other organisations are setting budgets based on the presumptions that some of the things they are planning to do will deliver the financial benefits that they require. And I think that's just a factor of how we have to proceed, given all the issues that have got going on, and given the very point we were discussing earlier on about the lack of reserves, for example. So there's a lot of assumptions in there. I think it's important to set a budget, to just continue this process and start to drive out some of the detail behind some of these things we've been talking about.
Okay. Lynn, does that help to answer your question? Fiona, did you want to come in on Lynn's point?
Yeah, I was just going to come back because your question was around confidence, and just to give you assurance that we have been testing this out. We with our kind of business partners, Liam McDonald and Chris King, around with the GMs around testing this out, and also using the data to support it. So one of the things I'd mentioned was around kind of care homes and the volume going compared to how it had been. So I suppose just we have done testing on this to get us to kind of just, I suppose, just assure ourselves when we're also assuring you. And the other thing is, I suppose there is risk. It's being honest about that. We're dealing with people, and we want to just make sure we follow due process as we do that. So yes, we've tested it. We can give you assurance. We're confident it's the right thing to do. We want to move rapidly on it, but we also recognise just process and people and the impact on that. And we're going to mitigate against that spend as we go into the next year. And that's why I think, back to David's point around getting the regular feedback and that kind of agility and engagement that we've got with both finance teams, so that we're not sitting later on with a gap that we're not anticipating. Sorry, Lynn, I'm hoping I'm answering your question.
No, that's okay. I've got more, I'm afraid.
Yeah, just
the next couple of questions are really around the summary of grip and control. Now they're broad, so I suppose it's to try and help me get context around some of this. So the first one is around prescribing. So we've got in that table that there's £899,000 worth of savings to be achieved within that. I suppose I'm conscious of that's an awful lot of money. How big is the prescribing budget? And within the prescribing budget, are we maximising what we can around social prescribing? Because, you know, prevention is always better than cure. And, you know, it's if you take someone's got a difficult shoulder, instead of giving painkillers, can we prescribe swimming lessons or something like that?
Okay, I see Jamie McGraw and David Hood's hands both up to help answer that question.
David, do you want me to go first, or would you like to go first?
Yeah, go first, Jamie, on the prescribing, and I'll make a general comment in terms of that.
Great,
grip and
thank
control.
you. Yes, you're right. It is a larger budget to deliver. The prescribing spend in East Lothian is about £22 million a year, just to give you sort of that kind of context. And we've got a really well-established system across Lothian to identify and make improvements to prescribing. This is something we do every year, and there is a constant process to it. It's quite a complicated program, because costs change and the availability of drugs change, evidence changes, new drugs come online. And so there is a constant need to be adjusting and changing what all of our prescribers are doing to be able to be as cost effective as we can. And Lothian has one of, if not the lowest, sort of costly sort of prescribing systems in Scotland, and that is about the work that goes on across the system to deliver those. So some of the changes that we have in place, we have things like Script Switch, which is a system that's on general practice screens. So when there's a prescription about to be issued, this system pops up and says, well, actually, there's an alternative medication that does the same thing that you're wanting this medication to do, but it's cheaper. So it helps the prescribers to do that work. So that is a challenging amount to save. It isn't just the work we do at a prescribing level, but it's also to do with procurement at a national level over different drugs. So there's a range of things that will work to contribute to that. In terms of the social prescribing, it's a really good point. We do have programs where there are referrals into physical health and supporting physical health instead of the prescribing. I think it's something we need to look at doing more of, as well as the other range of services that we have and the other support we have.
Thanks for that. My other question on grip and control was possibly a bit of a daft lassie question. I love that phrase, Maureen. Thank you very much. When we're talking about service redesign, are we talking about redundancies?
David, did you want to come on that one?
Yeah, so there's probably, thanks. So there's probably a couple of things that I just want to say around the grip and control. So one of the things we've tried to do is just expand and put in as much information in the report around the grip and control schemes that we've been working on and the teams have been working on. I think this is something that we would do pretty much every year in terms of trying general efficiencies. And as a normal kind of course of business, we would try and deliver around 3% of grip and control or efficiency savings. And the magnitude of savings that are there of 4.7 million ties in with that. It's slightly less than 3% of our budget overall. So it's not out with the kind of the norm in terms of what we would have. I think in terms of direct answer to your question about redundancies, we're not expecting or planning any redundancies for any member of NHS Lothian or East Lothian Council as a result of the whole savings programme here, not just the grip and control. We would look to support people, staff members into redeployment if their job changed, etc., but no redundancies whatsoever.
Okay, thanks for that. My last question, you'll be glad to know, is, well, maybe not, is around the issues of the closure of community services. Obviously, there's a significant concern locally about the impact of the closure on folk who might, anyone who is currently resident there at the moment, but also those who had maybe identified as part of their own ageing journey or whatever, that those might be preferred destinations for them. These are community facilities that are absolutely loved within that facility, within their communities, for a number of reasons. And some of that's around the ease of access that family, friends and others have to be able to make the residents' lives as comfortable as possible in those locations. So I'm very aware that we've also done an awful lot of work around what the strategic planning requirements are. And I suppose some of that has not necessarily been teased out within this paper. I kind of wanted to give officers an opportunity to just give a really brief sort of indication of what you had highlighted within that as it relates to these proposals about continuing community-based services that we either maybe need to look to commission in the future, or that we're looking to do something different. And the last bit on that is that these are, if we make the decision to close these facilities, NHS Lothian as one of the partners and East Lothian Council as the other have assets. Can we as an IJB be pushing both our respective partners to make sure that if those facilities are released as assets of land and building, that we wish to see them deliver ongoing health and well-being facilities in the future, rather than just simply being sold for private housing, for instance? There's a lot in there, I appreciate.
Laura Kerr, did you want to come in?
Yes, and I hopefully will answer your question, Lynn. So you're talking about the care homes and the residents that are in there, and the love and the emotion that goes around those care homes that have been there for a long time in some cases. All valid and all part of very much the work that we have been doing and the engagement that we've been doing. I think what you were stressing on or asking us to elaborate on, which wasn't really dealt with within the paper, was the provisioning of older people's services and the work that's gone on around that. Now, there are links within the papers to the website and the details around the pieces of work and the extensive engagement that's gone on there. I think the key points to pull out of that in relation to the Abbey and Belhaven, so North Berwick, the care home beds, we have a high number of care home beds in that area, too many really for the population that's there. Conversely, in the Dunbar area, we don't have enough. And it's how do we manage that as a partnership when we don't have assets, we don't have capital, and we don't have money. And I think your last point is valid, and I think is probably what we are trying to do, and we are working towards with our partners to say exactly what you've said, particularly around Belhaven or the Dunbar area. We need to move forward. So we recognise the need for beds, we recognise the need for a community hub, we recognise particularly engaging with the community there, what they can do to help that, and what we need to do with what we have available, and working with our partners to make that a reality. We don't have the ability to build a care home, but we have the ability to say, look, this is what we need, and we need it to be modern in a way that it delivers the services that we have heard and we know are needed in that area. Community, accessible, meets the needs of the people that are there, prevents them having to travel further for care home beds. We haven't got a sustainable bed position within the Dunbar area, but without moving forward, we're never going to get there. So it's really important that we have that bravery to move forward and make these really difficult decisions. I suppose reflecting slightly back on the Abbey, and Gillian may want to come in, I suppose it was interesting and a good reminder to hear when Gillian was engaging with the staff there, just their feelings equally of we could do better for these residents. This isn't the best facility that we have, and we want to do better for our residents here, and they deserve better. And we want to be able to work in a place that allows us to support them throughout their aging process. So yeah, I don't know, I hope that answers your question. I suppose a lot of it is to do, and a lot of information is available on the website that details that lengthy kind of engagement process, that importance of us having beds in the right places and the right number of beds, and also the critical bit about supporting our communities to help us deliver health and social care services, and to do that in facilities that are fit for purpose. So yeah, I appreciate there's not the detail of that in the papers, but the detail is hopefully there online. I hope people have had a chance to look at that.
Okay, can I let Gillian Neal come in? I think that's probably on the same point, Gillian.
Just very quickly, I think just to share that it did strike me when we met with the Abbey staff and the Belhaven staff, obviously, to share the proposals that were being presented today, and the staff very much acknowledged how the environments are very old and are very much not conducive to meeting individuals' needs. And they just gave examples about, you know, we don't have ensuite facilities for everybody in the Abbey. We've got 1 shower and 2 baths among 29 residents, and that they're carrying commode pails along corridors. And I think it just really struck me as well. And the last point was that, you know, the Abbey and Belhaven are meant to be care homes for life. If needs do change, we can't get hoists into some of the bedrooms at the Abbey, which again sometimes means that people have to move to alternative care homes. So they were really passionate that yes, the Abbey's well loved, it's very much of the community, but the environment no longer meets individuals' needs as they get more complex.
Okay, thank you, Gillian. And Lynn, does that help to answer your questions? And if you had any more?
No, I think that's been really helpful context, especially given that we know there's a number of people watching, actively watching this just now. There's a lot of community interest, so I think it's useful to have that broader discussion than just what's in the paper. So thank you very much for that.
Okay, thank you. Move on to Marilyn McNeil.
Thanks, Shamin. Just a few questions and comments. In relation to the care homes, does the IJB think there will be a bit of a betrayal in trust of the community because it was told during the consultation process that no decisions would be made until that process ran through its course, and there was a schedule that was published and that for that to run through the rest of 24. So, that is, does the IJB have concern about trust and what the impact will that be on going into the future? The other thing, of course, is that the Scottish government has given assurances that Belhaven would not be closed until there was another facility in its place. So shouldn't they be pressured by the Health and Social Care Partnership to be true to that position? The second question I have is that there are no concrete plans for mitigation of transport, public transport to the community hospital for residents of Dunbar in particular. It can take 2 hours using 2 buses for an elderly person to get from Dunbar to Haddington. And is that really acceptable? Is that local care, which is one of the philosophies of the IJB? Third issue is there'll always be a need for care homes and palliative care places, however good intermediate care is. But there will be no local beds if these care homes are closed. So again, this goes against the philosophy of the IJB in terms of providing services close to where people are. In relation to intermediate care, there seems to be major issues in getting staff for the hospital at home service and such. So how is that going to play out? Is that going to be satisfied before actual closures get underway? And the last question is the integrated impact assessment actually of the community link worker makes an excellent case, if you read through it, for the retention of the level of link workers that are there. And the savings from that are really minimal compared to the impact on prevention of health and social impacts that will take place if this service, which is a fairly new, innovative service, is cut down the way it looks as if it might be. Thank you.
Okay, thank you, Marilyn. I can see Laura Kerr, her hand up.
Yeah, I'll try and just go through your points, Marilyn. Thank you for those and very clear. You're correct. The decision that we're asking, all the proposals that are being put forward are, if you like, trumping the work of the provisioning for older people's services. However, the premise of which we're coming here have actually been borne out of some of the work. So the particularly around the beds, we have recognised within the provisioning work the distribution of beds is not correct in terms of care homes. We have recognised that the capacity within the community hospital is met with the hospital beds being based there. So therefore, although you are correct, we are asking for those proposals today, but they don't fly against what our findings were from the provisioning work. And part of that was your sort of second point about the importance of having those local facilities, particularly around Dunbar, our ability to respond to palliative care either within a hospital setting, a care home place, or in somebody's own home. So you'll remember that as part of that provisioning work, one of the models that we are being asked to look at, and one of the strategies we are being able to asked to look at, and we will look at, is around palliative care. And I know Sarah's Gosner is on the call here and will lead on that to ensure that we are meeting the end of life care needs of people and their carers. So yes is the answer. It has come much quicker than we wanted or we were expecting, but we must respond to that. And I suppose what I'm pleased about is we're responding in a way that's agreeing with the information and the engagement and the consultation that was coming, or the information that was coming from those engagement sessions that we've had and the research that we were doing. In relation to transport, I agree. Again, it's a big issue that has come throughout the many engagements that we have had with all a number of communities, and it's again something we work with our partners to try and address the challenges there. We will continue to do it. It's obviously not a service we deliver, but it's something we will continue to work with our partners to try and improve transport to care facilities. I think your final point was, oh no, you asked about staffing. Again, I suppose it's that bit where, so we obviously don't hold capital. We are not in a position to build a care home, and there are not, I know there is, and I'm aware of the promise from the Scottish Government to have a replacement facility prior to closing any other facility. I'm not aware of that. And I'm not sure how realistic that was, but what I would want and what we are looking to do is to continue that pressure with our partners, or that support to our partners, to say we need facilities like this, and what can we do with the independent sector, with our partners, to help build those facilities we all recognise we need. But what we can't do is stand still with the facilities that aren't making or aren't meeting the needs currently, in a hope that something will happen somewhere else by somebody else. We're going to have to move forward and not continue with facilities that aren't fit for the current delivery of services. The Community Link Working Service, yeah, I'm aware of the IA and the services. Jamie may be better off speaking to this. I think it's just the reality of we must make sure we have this pressure, and we have to meet the financial gap while still trying to deliver those services. It's just about to go through a procurement process. Jamie, you may want to come in and speak to this better, but I think it is about using all the services that we have to recognise the good services that the Community Link Working Service has brought, and continue to build on that, albeit we don't have the finances that we had previously. Jamie, I don't know if you were able to come in more on that.
I think only to say that the IIA is one of those tools that helps the IJB to make the decisions over these difficult choices. There were a couple of us on the call here today that were part of that IIA process. I think, Marilyn, you're right to bring it sort of to folks' attention. It's a really important sort of part of that IIA, as well as all the IIAs that support the proposals going forward.
Thank you, Jamie. Marilyn, does that help to answer your questions?
Yes.
I can pick up the one around you talked about putting pressure on. I can maybe pick that up at the very end. Okay, thank you, Marilyn. I have David Binney next.
Thank you, Chair. Two questions. The first, a number of these proposals will impact upon carers, a little bit in this proposal, a little bit more than that proposal, but collectively it has an impact, probably of significance. And we have done, as we've just heard, a number of impact assessments, an impact assessment for each proposal. And that hopefully will identify the impact and mitigation which will arise from what we're proposing to do. And we also know from experience, I'm sure all of us do, that when there are a number of proposals that are interacting with each other, very often there are unintended consequences that arise, unanticipated things that we haven't quite envisaged. So should voting members decide to proceed with the proposals in front of us today, I would like to suggest that the Carer Strategy Officer in the partnership be asked by the IJB or by the Chief Officer to monitor the impact and mitigation that have been identified, but also to seek to identify any unintended consequences that are starting to arise and to report that back to the Carers Change Board in order that things arising are being identified quickly and being able to be addressed readily or understood, and that it would also give assurance to the carers community that things were proceeding as anticipated, or if not, that things were being done to address it. That's the first question. Can we do that?
Laura Kerr?
To be fair to David, I think he was asking the IJB. I think I can respond on behalf of the IJB to say, yes, I'll start as Carers lead. I will definitely discuss that with Maria, and Maria's already picked up the cumulative effect of the budget reductions has had a disproportionate effect on carers. They are affected most, if you like, within the cuts. As with all the budget cuts, particularly around providers, third sector, and we will continue to monitor and review, and certainly, yes, we'll be keen that Maria brings that back to the Change Board, and I will tell her that it was you that suggested it, David, because it'll be a lot of work for her, but she will gladly do that and bring it back to the Change Board, and I think we will review that in the Change Board meetings, David, and that's a good idea.
Thank
Thanks
you.
for that.
I'm sure it's time well spent. Second question. Thank you. The second question relates to David Hood's comments, replying to an earlier question, I think, from Lynn Jardine. Possibly, I might be wrong in that. And it relates to redundancy. And it's very good to be able to give assurance to staff in the health sector, employed by the Health Board, and in the council sector, employed by the council, that there's a kind of no redundancy policy afoot. In terms of kind of equality, we have on one hand this for people that are employed within the kind of state sector. Do we have any similar proposals to support people within the voluntary sector who are being adversely affected by the cuts in front of us, by the changes in provision in front of us?
Laura Kerr?
Wasn't sure if David was going to come in. So no is the honest answer. We don't have that ability to impact on terms and conditions of obviously other employers. I think it just almost goes back to your other point, the importance of officers, particularly our commissioning officers, to review and support organisations, and a lot of the conversations that have been had with the commissioners and the providers is about what is the actual impact. Is this a post we're taking away? Is this simply is it a minimal impact? And none of them, as far as we're aware, have been about posts yet and removing of staff. But yes, so no is the answer, but we are supporting and continually reviewing our support to our third sector and our independent organisations. I take your point, it's very well made. Thanks, David.
David, did you want to come in on that point to answer David Finney's question?
I think Laura answered it very eloquently there in terms of her answer. So I think it's something that we'll obviously work with our colleagues and partners in terms of any impact, but we're not aware of any specific impact at this stage. But it's a good point.
Okay, thank you. David Binney?
Thank you for the answers. The latter issue is one I think I will return to over coming months in slightly different guises, but equality is terribly important.
Okay, thank you, David. I have Andrew Cogan next.
Thanks, Chair. These are kind of just general observations. I'm not looking for specific answers, but nods around the table would be sufficient. I just looked to David and Fiona. These are probably papers that you didn't want to write. And across the whole of the IJB's community, this is responding to a set of circumstances. And I just have to commend the professional way in which the officers have responded over the last few months to an external set of circumstances. And as I said, these aren't papers that people didn't want to write, but you've been put in a situation where you have had to stand up and face the challenges that have been raised. And I think I just want to commend the professionalism by which that has been done in what has been clearly very difficult circumstances. The second point is more a general one, is that just assurance that the IIAs are not static. They don't finish now. They will continue as the process goes on. And I'm seeing nods around the table, and we have to take assurance that you will be constantly reviewing and monitoring the impact of the decisions as they go forward. And I think it's really important that as an IJB, we acknowledge that and we accept that. And I just put a comment in. I think the depth and the quality of the IIAs is pretty good, and I wish to see that continue as we go through the process. And the final little point is, and I have raised this in all of the various workshops, and I would look to the members of the IJB who hold a professional responsibility to be assured that you have viewed all of the proposals with your professional hats on and are assured that they are as safe as they can be within the challenging situations that we have faced. And I'm seeing Sarah and Fiona and others nod. And I take great comfort in that, because I do deeply respect the professional standings that you have. And I think it's really important as an IJB, we acknowledge the professional responsibility of the officers who have put these proposals forward with all of the due diligence that they'll have put into the work. So thank you.
Okay, thank you, David. Sorry, Andrew. I've got Maureen Allen next.
Thanks, Shimeen. I put my hand down and I went to number 6. I want to go back to Fiona and her conversation with Lynn Jardine, which seems to have been forever. You offered Lynn reassurance around about the discussions, with the business and finance and testing the data, and the talk about mitigation. I suppose, what my ask is, what measures will be put in place to mitigate against potential service disruptions and increased waiting times resulting from these budget reductions? My next one to that, Fiona, I'll give you them all at the one time because it's you. And how will the reductions align with the broader healthcare strategies or IJB strategies and priorities for East Lothian, particularly in terms of community-based preventative and early intervention services? And my third one is picking up on one of the things that David Binney picked up on is, what strategies are going to be put in place or increased to ensure that reducing the budgets does not compromise the effectiveness of any of these programmes within the community and third sector in addressing health inequalities.
Okay, no, can you hear me?
Yeah.
Yes.
Yeah. Okay, good. So no, absolutely fair questions. I suppose my role is around the balance of performance versus financial balance versus outcomes for people. So we're anticipating, and it's back to this is the least worst option, and we've looked at the data. So we don't anticipate that delayed discharges or waits for acute hospitals go up. So around that waiting times. But there are consequences of having to make decisions. Our priorities, we're still very much focused on the IJB strategic plan, looking at early intervention, looking at home first, care close to home. But we are having to do that around kind of prioritising risk. And there will be impact. And that's the purpose of the IIAs, the monitoring around the financial balance. And then the last one is the commitment around, Maureen, just around kind of the impact of reducing or the priorities around that kind of early intervention prioritization. We are committed to do that. The challenge we will have, so we've got a set of proposals going forward this year where we have identified through IIAs, we're trying to mitigate the risk, and that will be through financial monitoring, it's through performance, and some of that works daily around our flow huddle, some of that works weekly, it's our engagement around that kind of with our general managers, but there's no question we're in a space and we're not alone where we are having to make difficult decisions, and we're trying to balance that impact, and that's using our professional colleagues to do that and make decisions in a different way. So it would be unfair to me to say at this stage there won't be impact. We're just trying to to ensure that the least worst option, and some of that comes into the link workers, some of it comes into the grip and controls and where we're choosing to spend money, but we're trying to be really transparent around our decision making and how we get there, balanced on that kind of model of outcomes, performance, financial balance, and that's similar to around how our partners are working as well, and kind of publicly up and down the country. So the reason we have tools in place is to, and David's raised it, is to try and understand what's the impact, what's the unintended consequences. Some of it we don't know yet. We're making decisions on the data available, and it is around the monitoring and the agility to be able to do that, and that requires that kind of full focus of resources to be able to do that. That's the finance, that's the waiting time, all of that, and we do that well within East Lothian. We do that well, and we can see that from a performance perspective.
I hear exactly what you're saying there, Fiona, but for me, again, it's the impact on the communities. You're looking very internally there, that, you know, you're talking about flow huddles, financials, and actually, if you have blocks in community services, so the waiting lists, I know for some organisations already are sitting, you know, quite relatively high at 3 months, and they're already telling me that with budget reductions, that waiting list is going to go up to 8-12 months. Now, that's already an unintended consequence potential of these, or because of these discussions. So I suppose what I'm looking for is some reassurance around about a holistic view. How are we going to be able to feed in this information to you? How are we going to make sure that you're aware that you know, potentially it's a ripple effect, I suppose, is the easiest way of saying it. How do I make sure that whatever or however I'm communicating with you, and Laura, I know you're going to come in here and say, will you speak to me, but, you know, how do we make sure that it's as robust a process as possible to make sure that the effects of any of these decisions made here today are as little or as, you know, as possible?
Yes, Laura will come in, but some of that is through the discussions today, but day to day it's through commission officers, it's through change boards, it's through the relationships we have, and there's no doubt about it. You know, we're not just looking at internal, it is the external. We know the wealth of kind of third sector and how that supports us. There's no getting away from it, and it is about how we take people with us. The important thing for me as chief officer is that we're being completely transparent. We're not shying away from it. But how do we keep these conversations and understand the risks, and we hear from other people's worlds, their local communities, and how's that fed into the impact? And we've had these discussions throughout. So keen to keep that. Laura, do you want to just come in on that, because that is important?
Yeah, I suppose you've said it. I think there will be an impact, and we're not denying that. We're not saying that's not going to happen. I suppose the commitment from us is that this is not going to be another surprise in December this year, that we are already committed to working, and we are already working on the impact of the changes in the financial position that we find ourselves in, and we will continue to do that to make sure that, you know, where a particular area is struggling, what do we do? How do we change? How do we innovate? How do we make the difference? And how do we recognise that soon and support our partners to make the changes? It's not easy, but I think we have very good relationships with particularly with our commission services. We have very open relationships with the commission services, and obviously I'm not going to tell you what you already know about the work we do with yourselves, but yeah, we just need to support, we need to be open, and we need to be showing the impact and how we're going to mitigate some of those risks. And I think we have got systems in place to do that, but it requires a lot of work. And as David pointed out before, he's asked that carers are clearly reported back, or the impact on carers is reported back to the change board, and that'll be one of many ways that we make sure that the impact is recognised.
And thank you for that. So can I just have one final thing, Shireen, and it's around about the redundancy. Obviously, the luxury that the statutory services have, the no redundancy policy, and I would love that for the third sector. What I would like noted is obviously these cuts will have a detrimental effect on staff morale and workload. for the third sector and for the communities, for carers, and we don't have that protection. So again, some recognition round about that would be good when you're making this decision. Thank you. That's me now.
Okay, thank you, Maureen. Elizabeth Gordon.
Thanks. My comments were more observations than a question for any particular officer. I just wanted to say that, you know, obviously we've all been very thoroughly consulted as part of the process with the meetings that were held. And I think my own view as a member of the board is that the IAAs have been very thorough. I think we are obviously in a very difficult position. And I think as I think it was David King said, you know, we need to spend money. We can't spend money we don't have. We need to have a balanced budget. And I think when you look, I mean, for people for the people involved, the staff and the most of all the residents, I can see that the Eddington Abbey and Belhaven decisions are difficult. But at the same time, when you read the IIAs, it's very clear that the problems within those facilities in terms of not being fit for purpose for modern provision. And I don't think that in the long run, those facilities could serve people well into the future because of the constraints, particularly when you hear about the Abbey with lack of bathroom facilities, and you hear about fire risk and risks to staff welfare and things, safe evacuation routes. And I think we need to think about all of that and in the context of this very difficult decision, weigh it up. And so I just wanted to say thank the officers for the IAs for mitigations that they're going to put in place, and acknowledge the fact that this is a very difficult decision that, you know, we don't want to be in, but because of the budgetary constraints, we are in this position. And I do think that we need to accept the proposals for the budget. Thank you.
Okay, thank you, Elizabeth. I've got Thomas and then Gordon.
A couple of things. Just on Marlon's point regarding public transport, that also affects the staff as well as the relatives. A lot of the staff in Belhaven, for instance, walk to work because we employ quite a lot of local staff. So that would have a huge impact on the staff. Belhaven Hospital is 112 years old. It's not fit for purpose. Hasn't been for many, many years. I can go back to 2009 to the older people strategy, and Belhaven Hospital and Eddington Hospital and the Abbey were excluded from the older people strategy because it was identified then they weren't fit for purpose and they were to be re-provided in 2009. We're in 2024, they're still never being re-provided. So there's, and not a lot of money was spent on them until just last year in Belhaven. But the fact that we have spent a lot of money in Belhaven, the fact that the Care Inspectorate just did an unannounced visit in Belhaven Ward 1 just a couple of months ago and it scored really good, why are we not opening Ward 3 with the same kind of model as Ward 1, which would generate some funding? As Laura's identified, there's not enough beds, care home beds in the Dunbar area, and we're sitting with an empty ward that has just been refurbished, which we weren't looking at closing the whole hospital. To me, you're ripping the heart out of East Lothian. All the inpatient beds would be up in Haddington. That is ripping the heart out of East Lothian. That is not providing a service for the people of East Lothian and the staff of East Lothian. And the minor injury unit hasn't even been mentioned here today. That has a huge impact as well because the nearest minor injury unit to East Lothian is Little France campus. That's unacceptable in the year 2024, especially given that East Lothian, the population is growing so quickly in East Lothian, and yet we are depleting our services. I think we're looking at it the wrong way, and I know there's hard decisions we need to make. But I'd like an answer on Ward 3, if that's possible. Could we use Ward 3 as care home beds?
Fiona Wilson?
Yeah, I'll look to Gillian to support me on this. Ward 3 was considered temporarily, but it's a different layout of the ward. I mean, these are we talk throughout this around people, their home, the facilities they have, and Ward 3 is not an option. And it's also bringing in the discussion around capital monies. There is no capital monies. That is the challenge. I absolutely acknowledge your point around the money spent in Belhaven in the last year, but the challenge that has been picked up by the fire officer is the isolation of the site, the evacuation from Blossom House. So it was considered, but people wouldn't have their own room. It wasn't pragmatic. All of these things, and I suppose the engagement to get to this point, we want a long-term solution for people, and we want them to have a home, and Ward 3 wouldn't be a home. Gillian?
Yes, just building on your points, Fiona, because obviously before we made the decision to move the residents due to the fire, we worked with the fire commander, and there was no option around Ward 3, and it goes back to your point, Elizabeth, around that, you know, they are very old buildings and we can't modernise them and they'll cost too much money. I think, again, just going back to your point, Fiona, there are not just fire hazards. There's been a number of fires in the community garden that is obviously creating fire hazards, and also that lone working within the Belhaven site, and all these things have been considered.
Okay, does that help to answer your question, Thomas?
Yeah, it does, but if Ward 3 was open, there wouldn't be lone working because it wouldn't just be one ward. Just my last point, just on David's point about the redundancy, I'm aware that NHS has a no compulsory redundancy policy. I'm not aware of the council having one for the staff in the Abbey.
David Hood?
Yeah, so just to clarify that Thomas, so you're right in terms of NHS Lothian and NHS Scotland has that no redundancy policy. East Lothian Council does not have the same policy. However, we would not be proposing to make any staff redundant, employ staff into vacancies, and work with our partners, trade unions, etc., redeployment, HR to support staff.
Okay, does that help to answer your question, Thomas? Okay, thank you. Move on to George Gordon and then George Maguire.
Obviously, I'm a visitor. Basically, at this point, I've not taken part in a lot of the discussions, but I had to satisfy myself that due diligence has actually been done before I could actually put a conscious vote in this procedure, and I can see that that's been done. Fiona used a very key phrase from you. This is the least of the worst, the best of the worst, which is something I've used a lot of the time going through Edinburgh IJB and West Lothian IJB. It is really to that level. The question that I would like officers to actually really highlight is what happens if we don't settle these budgets. There's a risk if we don't do that, that more draconian and worse measures could actually be put in place and not necessarily give us the same level of choice. So I'd like to hear officers actually state that. But I mean, nobody wants to make these decisions. It's happening right across the sectors, but it's something that has to be done. So if an officer could answer that question, I think it has to be highlighted to members of the public. What if we don't get this budget settlement sorted out, and what would happen if we had to look for brokerage or any other areas where we're then subject to get stuff put upon us rather than making the decisions for ourselves.
Okay, thank you, George. I've got Fiona Wilson and David King want to come in on this point.
I'll let David come in on the process, but the impact is that we would have to come up with different proposals, and some of them may be the same as before. But I suppose, and I touched upon this just as David was presenting the paper, we are doing this in a planned way. We would have to make reactive choices. And I'm looking to people like Lindsay Byrne, Chief Social Work Officer, Leslie Berry, Chief HP, Sarah, Chief Nurse. You know, the safety, the impact of this, you know, the consequences, you know, I would be working with them, and they would, I am no doubt, have concerns, because we would be mitigating against spend. And it's back to some of the day-to-day of holding spend on care packages, holding spend on, you know, setting up day centres, some of the stuff that actually has greater impact than what they were talking about today. I don't know if any of the professionals want to comment on that. just before David talk about the process, because I do feel that's important.
Leslie Berry?
I think safe staffing comes in for AHPs as of the 1st of April, and I think the concern would be that if jobs weren't able to be filled, then the support that would be for people in the community would drop considerably, the ability to keep people in their homes, and our safe staffing levels would drop to probably quite frightening levels, and then services have to stop, such as neuro support, etc., etc. So my concern would be that we would lose some of the essential services that keep people in their own homes and support them to be as independent as possible.
Okay, thank you, Leslie Berry. And Lindsay Byrne, did you want to come in on this point? And then Sarah Gosner.
Yeah, thank you. Just very quickly, I think Fiona raises a really valid point. We have to balance things all the time. And I am involved in conversations with members of the Health Social Care Partnership about risk of harm, primarily as Chief Social Work Officer, and always have to be reassured that decisions are made whilst prioritising the most vulnerable and the most at risk at our communities. And I guess just to offer that reassurance that decisions aren't made in isolation, or decisions aren't made that aren't really tricky, but with proper due consideration to the wider impact to everyone in the communities that we're trying to serve. And similarly, we're having to make tricky decisions across all of areas of social care and social work. But I just wanted to give that reassurance that I am involved as Chief Social Work Officer in reassuring myself and providing that professional governance that we are still prioritising the most vulnerable people and those at risk of harm in our communities.
Thank you, Lindsay Byrne. And Sarah Gosner?
Thank you, Chair. I think it's just coming backing up what Leslie's just said. It is around we're facing safe staffing as well in all of our teams, and that would be a real concern if financial constraints impacted on that for nursing as well, especially amongst all the teams that we have and all the care that we're providing. And I think for me it is about giving that professional assurance that time has been taken to have a look at all of the proposals, and that very much it's been a team approach, and that we have worked together, and that as professionals we've been given the opportunity to have a look at that and have a voice as well to provide that assurance.
Okay, thank you. Does that help to answer your question?
It does.
David.
It does help to answer my question, but it was the basic point is this is the worst scenario, but it's the best of the worst scenarios that we're actually facing. I want to give officers an opportunity to highlight that because we're asking a lot of questions to them, but they're not actually getting free rein to actually respond to that one question, which is what if we don't set a budget?
Okay, thank you. I think David King wants to come in as well, I think, on this point.
No, thank you very much. I do. I mentioned this very, very briefly in section point in the paper in section 7.1, where it says until the budget's agreed, the IJB is unable to issue directions, and that comes really nicely back to Georgie's point. If the IJB can't issue directions, then, and we've talked about what the operational, the system doesn't stop. So what does the operational management team have to do? They find themselves in a very difficult position. And I think Fiona and her colleagues have expressed that very, very clearly. But the key point is that the IJB now has no influence over this process. And I, for one, do not want to give up the IJB's influence. And I think it was a very well made point, George, actually. I wish I had written that down in the paper. We need to set a budget so we can continue to control this process as best we can. And we've spent a great deal of time and effort trying to express our points in the strategic plan and that whole planning process. So I think that if we don't set a budget, we lose our influence. I think that's what I'm trying to say. I think I may have said it twice. Apologies.
Okay, thank you. George, are you happy with the response? And do you have any other questions?
No, I won't take credit for that question. It was asked at another place, so I thought I'd ask it here because it really stimulates and focuses the mind, so that I think that's why I wanted to ask it finally.
Okay, thank you. George Maguire.
Thank you, Shameen. Firstly, I'd like to just align myself with the comments made by Thomas Miller there, and that I think this decision would rip the heart out of East Lothian. 3 closures of our care homes and hospitals, really unacceptable. And quite given the time that Mr. Miller also says that it hasn't happened overnight, the state of these premises. It's been ongoing for 50, 60 years probably, and it's probably a sad indictment on people in authority over those years that it's never been improved as time has gone on. And when you look at the impact that all these actions are potentially going to have, it's on the people that we're supposed to be helping and protecting, the patients first and foremost. Then we've talked about their family and support staff that have there, then the workers, how it impacts on them, local jobs and having to travel. But then we're moving the patients and people to other hospitals. And in this case, we've moved them to Haddington Community Hospital, Western General, the infirmary. Already we're talking about closing Ward 6 in East Lothian Community Hospital to move them somewhere else. We're moving them into hospitals that are already oversaturated with patients who can't get people out quick enough because there's nowhere for them to go. We all know these problems and challenges. How long before we start moving them to St John's Hospital and then further afield? The budgets going into the NHS are greater than they've ever been. We hear it all the time, more money is getting pumped in. And I know medicine and fields have all moved greatly and people are living longer and getting treatment they would never have had before. But with that more money going in, do we not need to be looking at the whole structure of the NHS? Does it need restructure? Is the structure now fit for purpose? And I'm new to Hamilton substituting today, and it's very interesting listening to the comments and thoughts going here, but it's certainly got my mind going, but it goes back to the beginning, but that we're actually impacting on the people we're supposed to be helping and supporting. And I think, as Mr. Miller has said, taking away these 3 hospitals, care homes, whatever we want to designate them now, is ripping the heart out of the people of East Lothian, and it's poor service for them. Thank you.
Okay, Fiona Wilson, did you want to come in?
Yeah, happy to. And actually, I really welcome your question, particularly for East Lothian. And I'm sorry that you've not been able to be part of some of the conversations that we've had. I know I've seen you at some of the provisioning work that I've been out in the local community. I think you talk about ripping out, and it's back to these are not easy decisions, and recognising these local communities of Dunbar, recognising North Berwick. I think that the opportunity we've had in East Lothian is we've demonstrated that actually we have less people in the acute hospitals. We're monitoring that on a daily basis. We are getting people out rapidly. We've invested ahead of other places in intermediate care. We've worked on the premise that people want to go to their own home, and really worked around some of the culture around where the assessment takes place and decisions made about people, without people. We've really demonstrated that we do that well. And that's recognised nationally in our performance. It's recognised locally around where people are. And I'm not taking away these aren't difficult decisions, but I think it would be inaccurate to say that people are ending up in acute hospitals, or because we are managing that, and we're managing that from a whole system approach. I absolutely recognise the point around kind of health boards, and maybe somebody else, David King, would be better to answer that more wider, or even just from an NHS board. There's that public sector reform, but that's not something that we can influence and we can recommend as an IJB. What we can do as officers is support the conversations, put forward recommendations, and very much focused on the people. And I said at the start, the people of East Lothian who are important to us, and we've engaged from early on around some of the direction we want to get into. But the impact that people anticipated that we might see at the start of when Eddington, the staff transferred, Belhaven, we're not seeing it in the acute hospitals. We're not seeing it in our delayed discharge performance. We're seeing more people than ever going home, and even better, we're seeing people going to their own homes, and that's what we're focused on, because it's linked to our strategic plan. But not getting away, and happy to chat further about it, that these are not easy decisions, and we know communities feel it. So I do not want to diminish that.
Okay, George, does that help to answer your question?
Yeah, that's thankful. No, I do appreciate it's challenging times and there's no easy answers, and everybody wants their bit done first, but no, I appreciate that. Oh, thank you, Shameen. Okay,
can I bring in Carol McFarlane?
Well, I was really depressed to see the level of savings that the IJB are having to make, and the only light in the end of the tunnel was, to me, to see that the Eddington wasn't completely closed. And at meetings with IJB senior officers, I was relieved to see that the community service, including MSK, CTAC and vaccinations, are to be retained. I'm afraid the closing of the Abbey has caused great furore in North Berwick, and perhaps it would be really good if Fiona or other members of the IJB could come into North Berwick and do a bigger explanation of why it has to close, etc., because it is of great concern for a lot of the residents, and many of them, the relatives of the people who are in there, have come to me with absolutely devastated the fact that it's going to close. I know the facilities are not the best, but the actual ambience and the staff are some of the best that I've actually ever seen.
Thank you, Carol. And Fiona Wilson?
Yeah, thank you, Carol, and thank you just for acknowledging the staff. And I know that's not easy. As you know, I've been and I will continue to engage with the North Berwick community, as I will with other communities. Some of the important work, even just in the last few weeks, that's gone on is around our communication and how we don't want to hear want people to hear who are affected by this about proposals going forward as they hit the press, and Gillian and Margaret Drew and the managers have worked hard on that over the last few weeks. So yes, continue to engage as we would. We have done this, and as you know, and I've been in North Berwick a couple of times in area partnership and community council talking about the provisioning work. Happy to continue doing so. We would all want to as officers. It's important. Local people are important to us, and we want to influence that.
Karen, do you have any other questions? Does that help to answer the question that you've asked?
Partly.
Okay. Do you have any other questions?
No, not just now.
Okay, thank you. Do we have any other questions from any other IJB members? Thomas Miller?
I've not actually got a question. I just want to thank you, Shameen, because I think you've chaired this part of this IJB superbly. You've given everybody the opportunity to speak, and me personally, who's normally quite quiet, may just speak once or twice. You've given me the opportunity to come back a number of times, so thank you for chairing a difficult meeting.
Oh, you're welcome. Just wanted to make sure that anybody who had a question felt that we're able to ask it and ask the officers that are here today. Some of the questions that I have some of them have been answered. I think it's really important that we get across that what the proposals have put forward, there are no job losses in those proposals. I know that it's not similar to what's happening in other IJBs across Scotland, so I'm really fortunate that that is not the case here. I wanted to ask about the Abbey Care Home, about the capacity of finding spaces for those residents in other parts of East Lothian, and just to give reassurance of if there are friendship groups or staff working with groups of residents there, how we make sure that we carry out that process with the most amount of dignity and respect with those individuals there. My other question was around the Belhaven. I know that a number of comments have already made of what previously has been promised by decision makers, and that has not come into fruition. I'm really keen that as we move forward, that both our partners work very closely together on the Belhaven site to protect that land, whether it be health or social care or health and well-being, and taking that forward. And I think in difficult times, it's really important that we work in partnership more strongly than ever. And I think that's really important. We do that in moving forward. On the Eddington, I just want to make it really clear, if officers can clearly highlight the position with Eddington of the delivery of community services and the delivery of the minor injuries, and that you have already been engaging with the local communities in the North Berwick area on Eddington, and that you will continue to do that. Gillian, did you want to come in?
Yeah, just on your point, Shameen, about the vacancies, as Laura's indicated earlier, we know that we have care home vacancies within the North Berwick area. So as we learned through the closure of S Green, residents and their families would be supported to make these choices. And again, I think we very much acknowledge the relationships that the residents have with, you know, fellow residents and the staff, and certainly would make every effort around that transition. And again, there's lots of different opportunities that we can do to maintain these friendships and relationships that they've made.
Okay, thank you. I just wanted to ask about the Belhaven and the Eddington, Fiona Wilson.
Yes, so from a sites perspective, yeah, we want to influence. We don't hold the the capital asset, so but we want to influence what that might be in the future from a planning perspective. With regard to Eddington, we have met with primary care, the local community council, around the perception around minor injuries, and that is still being delivered. With regard to the building, we're not tied to the building, but we want to keep delivering the services as long as the Eddington is fit to do so. It's again back to the condition of the building and the lack of capital availability to spend on it, and the recognised need that North Berwick does need a new building for their GP provision, and they're significantly up the list, but with no capital monies just now, that there's not a clear plan of when that will be in the next few years. So all of that impacts. So yes to the building and working from it for community services, as long as the building is fit to do so. We're keen to do that and recognising that local need, because we've done a huge amount through vaccination, MSK for local people with these services.
Okay, thank you. Do we have any other questions before we move on to comments? I want to give people the opportunity to make any comments before we move on to the recommendation stage. I don't know if anybody has any comments to make. I don't see any hands up. I just wanted to make just a few reflections, I think, of what's been happening in East Lothian IJB over the past decade. And what we've seen is a decade of growth in the population of both older and younger people, and that's great to be part of a county that's growing. And so from 2018 to 2043, East Lothian population has predicted to increase by a further 12.8%, reaching a total of 120,000 people, and we are growing at a much faster rate than anywhere else in Scotland. And with a growing population, the demand for our health and social care services has been increasing year on year. We see that in IJB reports and our performance reports, that the level of demand that's required across our communities is growing. And at the same time, the level of resources allocated to East Lothian is now at one of probably the worst levels in Scotland for both revenue and to deliver services capital. And that is the case for both our partners, capital for buildings. Our independent research from the Scottish Parliament tells us that whilst other areas in Scotland over the past 10 years we're seeing an increase in the capital funding, over the same 10 years, East Lothian has seen a reduction in its capital funding by 22%, which goes towards some of our buildings. To the people that are listening outside the IJB, you're right to ask, what have you been doing to address these issues? And you're right to ask Marilyn about what pressure, what campaigning have you been doing? And I can tell you that we have raised all of these issues directly to the First Minister, directly to the Deputy First Minister, directly with the Health Minister over the past year. And when we have raised those issues, I know that they're very well aware of the good track record East Lothian Health and Social Care Partnership have, because before I even say anything about our delayed discharges, they know that we are a good and high performing health and social care partnership. So on funding, I'm bitterly disappointed that we continue to be one of the fastest growing areas in Scotland, but also continue to be one of the worst funded across Scotland as well at the same time. And that's despite raising those issues and highlighting the good practice. And we're not asking for preferential treatment. All we are asking for is to be treated fairly and to be funded fairly to manage the rise in demand for our services. Our direct calls for fair funding have been continually rejected, and that is why we are in the position we are today. Nobody on the IJB wanted to be in this place, in this really difficult and challenging position of having to address a £10 million funding gap. But as officers have highlighted, they have worked hard behind the scenes, leaving no stone unturned around grip and control and efficiency of how we run as efficient our organisation as possible. But that still hasn't enabled us to fill the gap. And now we're having to look at these really difficult decisions. But unfortunately, this is where we are. And that's why we are having this IJB meeting today. I want to take the opportunity to thank the officers, because you've been asked to deliver services in the most difficult, challenging of environments, but you've also been asked to look at your service and how you can make reductions, and that is a nigh on impossible job, and we recognise that. And we know the good services that you deliver day in, day out. I just want to take on board some of the comments that have been made. We will learn from this process, Maureen, as you've mentioned, about how we do things a bit quicker and how we engage better with the voluntary and community sector. And we have a good track record in East Lothian of working with the voluntary and community sector. Despite that 51,000 reduction in the voluntary and community sector, we're still investing £700,000 from that budget in the voluntary and community sector, and that doesn't include our day centres. I think we've also got to recognise that some of those services will continue to remain open to provide community services, like in Eddington. And also I'm really want to make sure that in the Belhaven site, we're aware of what the local community feelings are on that site, and we're aware of the work that has been carried on previously, and we're aware of the promises that have been made by other elected representatives. But I think I'm really keen to make sure and to have it minuted that we work closely with our partners to protect that land and protect that site, to see how we can, working as a partnership, take that forward, whether it be health or social care or well-being, in taking that forward. I'm really sorry about what we're having to do at the Abbey Care Home, but we've also listened to the officers, of the experience of staff and the experience of some of the residents there. And from what the officers have said, we will do that, working with those families and those residents and the staff, and carry out that process with dignity and respect, and ensure that they are placed in appropriate places in East Lothian to meet their needs. I've also heard things, Maureen, you talk about, Marilyn, you talked about betrayal, and I completely understand your feeling and how you feel in the words that you use. I feel the same, because I think that it has been a betrayal of the services that we've been delivering, the positive outcomes we've been delivering, despite being one of the fastest growing areas in Scotland, despite putting that case forward day in, day out, on a regular basis to elected representatives. Our voices are not being heard. But just to reassure you, that doesn't mean that we will stop raising those issues, because we know there is funding in the system that can be used differently. We don't need to have a national care service that costs £14 million to recruit 180 bureaucrats. And when we met with the First Minister, we made a direct call to him to say, don't go ahead with the national care service. Please put that money into health and social care, because that's where our frontline services need it. And our officers who have working on these areas, I want to thank you for doing that, and for helping us through a really, really difficult and very, very challenging situation that we're trying to manoeuvre ourselves through. All of the proposals that have been put forward, staff will work very closely with those organisations, working with them, and also ensuring that we're fully aware of the impact, for example, on carers, etc., as we move forward. It's with great regret that we're in this position, but I have to reassure you that myself and my colleagues have taken every single opportunity possible to raise all of the issues that we have been facing over the last decade to elected representatives over the last year, and thinking that they might maybe think differently, treat us fairly, but unfortunately that hasn't happened, and that is why the reason that we are here today. So it's with really, really difficult and great regret that these are some of the things that we have to do. But if we don't do them, I think the consequences and the other options that would be put in front of us would be far worse. And as one of the members have already mentioned today, this is the least worst option that we have in taking forward East Lothian IJB as we move forward. Okay, I don't know if anybody has any comments. If not, then we'll move on to the roll call.
Thank you, Chair. The recommendations are set out in section 2 of the report. Members are asked to please indicate if you're content to note recommendation 2.1, 1 and 2, and to approve recommendation 2.1, 3, 4 and 5. Councillor Akhtar.
Agreed.
Mr Cogan.
Agreed.
Councillor Maguire.
Agreed.
Ms Gordon.
Agreed.
Ms Ireland.
Agreed.
Councillor Jardine.
Agree.
Councillor McFarlane.
I don't agree.
Thank you. Mr Gordon.
Agreed.
Thank you. With 7 votes for and 1 against, the recommendations are approved.
Okay, move on to paper number 7, which is a non-residential charging policy for social care.
Thank you. I'm aware that charging is not delegated to the IJB, but we implement the charges and receive the income from the delivery of those services, which we then put in back into those services. So on that basis, it felt prudent to bring this paper to the IJB for noting on the proposed changes that will be made, that will be taken to the council to make the changes to the policy. So I'm asking the IJB just to note the recommendations that I've set out in 2.1 and the summary of the recommendations changed, summary of recommendations that will be made to East Lothian Council for the changes on the policy. The changes are quite significant and will increase the amount of income that is available to the IJB. I think what's important to note that although there are a number of changes, there are also still a number of protection measures that are put in place to prevent financial hardship as a result of the social care charges. There's also an appeals panel in place which meets every month to consider both means tested and flat rate charges, therefore offering again that reassurance that people won't be pushed into financial hardship as a result of their social care charges. So I would just be asking the IJB to note the paper and approve the submission of these recommendations to East Lothian Council for consideration. And I believe that'll go on April the 23rd.
Okay, thank you. Do we have any questions for Laura Kerr in this paper? Laura, I had 2 questions. One was around if we're seeing a drop-off in people handing back their community alarms at all, and if they are, if we know the reasons why, and if it is financial, what we're doing to support them. And I think that IIA made it really clear one important element of this will be that once people are aware of the charge, that they are fully aware of the appeals process. So I think it's really important, should anybody feel that they're no longer able to afford that, they have an appeals process which they can then go through to see how they can be supported. And just to ask how we'll make sure that we promote the appeals process as widely as possible, should there be individuals who are not able to afford it.
Okay, thank you. So we haven't seen an increase in alarms in particular coming back. We have had a few come to the appeals panel. I do remember I did email, but I can't remember off the top of my head. So we have waived a couple of charges in relation to alarms, and that's where, although the person is able to afford it, they don't wish to pay, but the risk of removing that alarm was too great. So we agreed that we would waive the charge, but the majority of people pay for their alarms, and we haven't seen an increase in people requesting alarms be taken back because of the charge. Again, if they do and it comes through that appeal process, even before it gets to the appeal process, there's a discussion with the individual about the risk of taking that alarm away and whether they need to keep it or not, and whether they have the financial means to pay for it or not. So I'm comfortable that we haven't seen an increase. We did some work with GPs and had the communication out with GPs as that was a concern being raised, and we also have that appeals process in place. Just on the advertisement or ensuring that people are able to make an appeal, so we have got a a good process, a clear process for the appeals panel. But I think, and just thought of this now, and probably what will be a good idea is that when we send out the financial assessments this year, we will make sure there's a link to the appeals process email address, so people can email in, but people are normally supported by their social worker or by the community alarm team to make an appeal if they wish. We also have advocacy on our charging appeals group, and they can also support people and do support people to make appeals where necessary.
Okay, thank you. George Gordon and Lynn Jardine.
Yeah, I mean, obviously we're moving towards more digital methods of keeping people at home for their home care packages. So alarms are just part of that whole process. Monitoring of movement in the households, other areas are really coming into the forefront these days. My concern is older people who are not really digitally capable, and cannot use websites, cannot use email addresses, that they're not left behind. That there should be some mechanism, which I've heard a wee bit about, to make sure that through their social worker or through somebody that is one of their carers, they actually get the information of how the appeals process works and the assistance they need, and including also flagging up benefit checks, because a lot of them have unclaimed benefits that they never get because they're unaware of them. So it's just a safeguard that I'd like to make sure is in place before we start mucking around with the charges, that may cause them to then react rather than inquire as to whether or not they can do something to mitigate the charges.
Yeah, thanks, George. And that is noted. Again, just the reassurance that anyone who asks for an alarm, particularly to be removed, they go through a process where it's discussed with somebody from the alarms team or a social worker if they have an allocated worker, to make sure those conversations are happening and they are able to make an appeal if they want to do that. Sorry, there was another point, but I've lost it. I'm sorry.
You know, it's also assisting them to do that. That's what I wanted to point out, because a lot of them have not got the capacity or the capability of doing that, and it's sometimes left up to the unpaid carer or family members, and a lot of people don't have that. So that's where I don't want anyone to be left behind and drop through the cracks. So I just want to highlight that as an ask of you to make sure that it does not happen.
Yeah, and I've remembered my point, which was, as part of that appeals, we have people from the financial assessment team who are linking in with income maximisation to make sure, for exactly your point, that where we see somebody's financial assessment come in, where we are noting that they don't have or not accessing benefits, then we can make a referral to income maximisation to ensure that they are getting all the income that they are entitled to.
Thank you.
Lynn Jardine?
Yeah, no, I was just taking my hand down because George and I were thinking along similar lines, but it was that specific and explicit link with income maximisation that I was looking for.
Yeah, thank you. Just one other point was the importance of, I know there some reserves have been set aside to enable us to switch from analog to digital, and how we make sure that doesn't get lost in this process. Because I think there's a cut-off date which we have no control over, that's just been set, and as a result we've had to find additional resources elsewhere to meet that need. Okay, I just want to check if there's any other questions or any other comments. I think just to make a comment, I think it's really important, the appeals process, and how we really monitor this once this is, you know, if it's passed, of the impact of people, and then go back and review it should there be any significant changes on it, and we're seeing a significant impact on people, and we would have to go back and then review it again. Okay. I think we require a roll call on this, Fiona.
Yes, thank you, Chair. The recommendations are set out in section 2 of the report. Members are asked to please indicate if you're content to note recommendations 2.1, 1 to 3, and to approve recommendation 2.14. Councillor Akhtar.
Agreed.
Mr. Cogan.
Agreed.
Councillor Maguire.
Agreed.
Ms. Gordon.
Agreed.
Ms. Ireland.
Agreed.
Councillor Jordan,
Agreed.
Councillor McFarlane,
Agreed.
and Mr Gordon.
Agreed.
Thank you. That's the recommendations approved unanimously.
Okay, thank you. Just want to thank everybody for their participation today, and thank the officers for being at the meeting today and answering everybody's questions. And I recognise this has probably been one of the most difficult and challenging IJB meetings that we've had since the inception of East Lothian Integration Joint Board. But I just want to thank everybody's participation, and just to reassure you that officers will be working really closely and monitoring how we take forward the proposals that are being passed today. Okay, that's the end of our meeting. Thank you.
Thank you.
Thank you.
Thanks, Siobhan.
Bye.
Thank
Thank you,
everyone.
Chair.
Bye.